Hi, how are you doing? I am State Representative Paul Baumbach, Delaware State Representative Paul Baumbach, serving the greater Newark area on the north and west side. And I have an unannounced quick update on retiree health benefits. This afternoon, there was a meeting of the State Employee Benefits Committee, the SEBC, and there's a part of the meeting that dealt with the retiree health benefits. So I wanted to give an update on that. I'm going to bring up another screen. Let's see if we can do this. That sounds good. Let's try that piece. There you go. There we go. That's probably better. So can I get this here? So this is the page that has all the meetings this year for the SEBC, with the earliest at the top and the most recent at the bottom. So let's go to the agenda. And what you see here that sort of matters, well, the meeting was from 2 to 4 o'clock, although I think we adjourned well before 4 o'clock. Number 5 was very important as it relates to retiree health benefits. There is an upcoming request for proposal where the SEBC issues it and asks for insurance companies to submit bids to provide a benefit. And during this agenda item, what they pointed out is that they're looking for it's really a plan administrator, so that it is looking for an insurance company to take care of enrollment, take care of requests for reimbursements from, say, doctors or other healthcare professionals. They take care of any co-payments, working with plan participants, etc. They do not make the decisions because this is a Medicare supplement plan, they don't have the same responsibilities as someone who's providing a Medicare Advantage plan. This is self-funded, which means all the bills are paid by the sponsor, which in this case is the state of Delaware. So they are just a pass-through entity for the payments premiums coming in to the state, payments to healthcare providers going out, any payments from participants would be coming in and also being distributed appropriately. What the co-chair of the committee, Secretary DeMatteis, pointed out is they are going to be requesting only one type of plan, a Medicare supplement plan, not a Medicare Advantage plan, not a Medicare supplement plan and a Medicare Advantage plan, but they're looking only for Medicare supplement plans. Now, for those who've been following closely, there's language here about substantially equivalent in design, and that no prior authorization. It mirrors CMS requirements under original Medicare. Some of these phrases are alarming to some retirees who have been looking closely at this for over a year now, and the fine print has proven to be worrisome in the past, and therefore there's a lot of anxiety about the wording. As verbally described, this is again only asking for quotes of administering a Medicare supplement plan patterned after the current MedicFill plan. They can't say provide MedicFill because MedicFill is a trademark of Blue Cross Highmark Blue Cross. So if another company wants to offer it, they can't call it MedicFill. But what this is intended, as we're told, is that they want the insurance companies to say, we will be doing the same thing that Highmark Blue Cross is, administering the plan with the same rules that are being used for a MedicFill. Importantly, the base is Medicare supplement. And what that means, I think if you look at the difference between Medicare supplement and Medicare Advantage, Medicare supplement leaves the base of 80%, which is traditional Medicare, covering about 80% of costs. And then the last 20% is done through a Medicare supplement, the supplement helper. And so MedicFill fills that hole currently. They're looking for an insurance company to administer that same Medicare supplement portion of retiree health benefits, continue to have prescription drugs under the current system. So that is a big change from less than a month ago when this same group, the SEBC, was talking about the RFP and presented information about looking asking for bids for both the Medicare Supplement and the Medicare Advantage. There was a question about grandfathering, and we talked about that at length. I do want to speak about it's in the ears of the beholder. There's different views of what the term grandfathering means, and I don't mean to laugh and say it's trivial, because it's not trivial. And I'll get to questions once I go through my comments here. So grandfathering can mean that those who are currently beneficiaries here, say current retirees, get the same kind of services tomorrow that they do today. So that be grandfathering. You can't reduce those benefits in the future. So that's one version of it, and that's a common use of it. Another one is saying that we're going to have two different groups within this service, and one group is going to keep benefits that are very similar to what they've had in the past, and the other group is going to receive a lesser level of benefits, but the grandfathered ones are going to get to keep the same look and feel of what they've had. That two population view is how I commonly use it, but I know from speaking to others, including those on RHBAS, grandfathering to them is more of the our benefits cannot be changed. We're grandfathered. We got these four things in the past, and we're going to keep getting those four things in the future. We are grandfathered. You can't change that from under us. One of the reasons I'm not a big fan of that version of it is that healthcare changes, and we've had an evolution of the Medicare supplement plans. So we keep adding letters to it. We used to just have F, now we've got G. So these things do evolve, so that it's to me, it can be misleading to say we're going to grandfather you if by that we mean we're not going to change any of your benefits. That's just it's just unrealistic if you're talking about a organization like the state of Delaware that's providing retiree benefits for decades and decades. I prefer to look at it as the two population one, where our current retirees and whoever else is in our grandfathered group is going to get this same look and feel of what they get today. But then a different group, maybe people who are not yet working for the state of Delaware, are likely to get a different, again, a different kind of package. I say that because the co-chair said, well, there's no grandfathering built into this request for proposal because there's only one population. We're only asking for one plan to be provided. We only expect to select one plan. It will be it'll act as a Medicare supplement plan. It will have the same kind of co-pays or presence or absence of co-pays and deductibles that the current MedicFill has. It'll have the same kind of coverage of services as the current MedicFill. And it doesn't matter if you're retired today or if you're retired on the last day that this plan, that we're contracting for, which, as they're saying, is currently planned only to run for 2025, 2026, and 2027. So if you're hired in December 1st of 2027, you would get the same benefits as someone who's retired today. So because there's only one population and no change in benefits across the population, the co-chair, Secretary DiMattia, said there's no grandfathering because there's only one population. She's using that second definition, which is one that I'm more comfortable with, but it is not accurate if you're using the first definition, and that just is what it is. They also extended they voted to extend MedicFill, which was originally set to expire the end of last year, 2022, and it keeps getting extended because the court said they couldn't change the plan they planned to go to, which was the Medicare Advantage, and it's going to take a while to get the next plan bid out and prepared, and January 1st, 2025 is when it's expected. So they officially voted to extend MedicFill through the end of 2024. So that's what was on the agenda. Under other business, there was little or anything spoken. I will say I was more than a little bit. I spoke up, and I thanked the SCDC for holding this meeting. This was not a planned meeting as of 2 weeks ago. It was announced about a week and a half ago. And this decision on item number 5, which I don't think they took a vote, but they nodded their heads, when they said the RFP is only going to be looking at Medicare supplement pattern after Medicare. So that's new, and they did that counter to what they presented on their August 21st meeting, but consistent in many ways to what our subcommittee, our advisory subcommittee, the RHBAS, recommended in our August 24th meeting. So therefore, I think they deserve our thanks for holding this meeting and considering that recommendation and really incorporating a good piece of it. My disappointment is that we did several other recommendations on the 24th that are not at all considered here, nor was I terribly pleased with how it was presented as, well, we'll wait for that final report to come out and then we'll consider those things. Well, it's a little bit of cherry picking. They took our recommendation to take Medicare Advantage off the table for this RFP, even though it wasn't in a final report, but they don't seem to be considering our other recommendations, including having the RFP, the request for proposal, voted upon, not just written by some, well, we don't know who writes it. Could be a SEBC member, could be a member of their staff, could be a consultant. I don't know. And in the past, these RFPs have not been voted upon. And one can say that led to the problems we had last year with a lawsuit and a court order to stop what we were doing, what the SEBC was doing. So I think that transparency, I felt it was important enough to bring a motion forward, and it was adopted by the RHBAS last month. No mention of that, no indication that the SEBC is considering that step. Furthermore, there's the issue of the recommendation from the RHBAS to have this next contract be another at least 3-year and up to 5-year term, which is what the PRAS one was bid as. Now they're looking for just a 2-year plan with up to one year extension. I understand the stated reason for that, to enable the SEBC to synchronize the 3 different populations we have of current employees, retirees under 65, and Medicare age retirees, and try to get the healthcare bids out as a single unit, and therefore perhaps get some cost savings because you have a bigger universe. We considered that, and I think there's 2 reasons why that was not compelling to us. Number one is by doing a 3-year plan for this new one to take us to the end of 2027. The plans for the current employees and the younger retirees can be extended to run out around the same time, and therefore you can still achieve it just 12 months later than you would otherwise. We want to have it longer in order to, we made some progress here getting Medicare Advantage. We want to know that Medicare Advantage can't show its face until at the earliest 2028. And by having just a 2-year with a 1-year extension, it gives us less flexibility, and it gives us less assurance of more years without Medicare Advantage being a threat. But they disregarded that. So that was disappointing, along with it not having the RFP, not committing to voting upon it, having available a week ahead of time, having public comment on it before the vote on it. So, I was glad I was there. 2 of the 11 members were there in person, and the rest were connected by phone or by live stream. There were the members of the public easily outnumbered the members of the SEBC in attendance this day. Okay, that's my rundown. And I only have a question from Bob at this point. Pulled a very diverse group asking one, if their retirement plans were increased at all each year, did they feel state employees should get this just because politicians can vote in it? The response is 1, no, and 2, absolutely yes. So were their retirement plans increased at all each year? So now, Bob, I know we've talked about different things between healthcare retirement plans and pension retirement plans. So I'm not sure which you're speaking of. This talk is about retiree health benefits, and that is in the title of this. So we're not talking about increasing health benefits. We're talking about maintaining health benefits. So I'm not sure that's terribly pertinent. And do they think that state employees should get this just because politicians can vote for it? Again, that really is not on the topic of retiree health benefits, Bob. But thank you for listening. So with that, the next meeting of the RHBAS is next Wednesday, the 27th, from 1:30 to 4 o'clock, still at Dover, Department of Insurance office. It will also be live streamed, and you can submit public comment in advance. You can be there in person and provide public comment, or if you've live streamed, you can also sign up ahead of time or raise your hand, and you'll be called upon and be able to give public comment. For what it's worth, I'm just a member of the public for this committee. I don't serve on the committee, and therefore I was limited to the same 3 minutes that anyone in the public is limited to. I can say that 3 minutes went really fast. Anyway, we'll see how things go. For those I've been saying, you can go to YouTube and see my latest update, and if you do that, you don't have to go to the past ones. Realize this is a special one. This is only about the SCBC meeting today. It's not broadly about the Retiree Health Benefits Advisory Subcommittee and its work. So if you catch this, please also consider catching the most recent recording on the RHBAS work. So with that, let me see. Will the RHBAS hold them accountable? So Andrea, thank you for that question. Keep in mind that there's different structures. We are statutorily, as in the Delaware Code, we are a subcommittee of the SCBC. The SCBC does not answer to us. The SCBC has 11 members. The membership was adjusted by Senate Bill 75, which the legislature passed in January and the governor signed into law. I'm hoping that members of the RHBAS will insist at their next meeting that all the recommendations from the RHBAS be considered. I want to thank Bob Clarkin for submitting into the public record. So this is what he submitted, and this is on the page of all the materials. This document submitted for public comment for today's meeting, and it was this file. And what is this file? It's the motions. It's the motions we passed, word for word. This one motion said, get rid of Medicare Advantage from the current RFP, and SCBC appears to have done that. Well, we won't really know until we see the RFP, and we won't really know until the SCBC votes upon accepting a bid. So then, the next motion having to do with members of the proposal review committee was not passed. So discuss the motion, no vote took place. It was actually tabled. There's 3 more motions. These are amendments to the motion. Okay, so motion number 3 was the RFP, in my opinion, is my motion, should be discussed in public, should be shared a week before the meeting. Public comment should come before the vote, and the SCBC members should be voting upon the RFP. And so that's, I feel pretty strongly about that. It passed. And then motion number 4, also from me, in fact, and seconded by Representative Mike Ramone, called for the term of the upcoming contract to be 3 years plus 2 1-year optional extensions, and it had 12 yes votes and 3 no votes. Nevertheless, SCBC seems to be disregarding that. And then the last motion was made by Bill Oberle, seconded by Jeff Tashner, and this had to do with actually, I guess it doesn't use the term grandfathering, does it? But it says that any changes to plan design, et cetera, only affect people who are hired after 2024, January 1st, 2025 and beyond. So that if you've been a worker and the rules as presented to you when you took the job were, here's what you'll get at retirement, we can't change that. If we're going to change rules for retirement, we need to tell people before they're hired. So that motion was also adopted. It was a 9-6 vote, if memory serves. That was the first question or comment from Andrea. The second one is to deform the committee with all of you, and now they're so we formed the committee with all of us, and now they're ignoring our input. Keep in mind that the bill that set up the RHBAS also affected the membership of the SCBC, and when you look at it, we've got a good number of members on there who are independent of the administration. So I think that we've got the potential to have the SCBC, insist on the consideration of the recommendations of the RHBAS. It didn't happen today. So perhaps between now and their next meeting, which I think is October 2nd, they will decide that they do want to, at that meeting, before hopefully they're going to vote, they're going to insist that they discuss and vote upon the RFP. And that's yet another recommendation. And hopefully they'll look at all the recommendations at that meeting and consider which ones they agree to. They formed it, right? So we will see. I was more hopeful before I got to the meeting and less hopeful when I left, at least for what would happen at this meeting, today's meeting. I'm hoping the next meeting will be more satisfactory to myself and other individuals who attend the meeting. Those of us who were there were not overwhelmed in a positive way. With that, I want to thank you. Sorry I couldn't announce it ahead of time. I just had some time and I wanted to get it while my memory was fresh on what happened and did not happen at today's SABC meeting. With that, I hope you have a good week and don't hesitate to reach out to me. My email address is there at the top. Thank you so much.